that all the people in Ukraine agree with these people, the war and all of this stuff? China was the most strictest and the most, vaccinated, the most like totally shut down to try to stop the spread. And so, but Africa is having a totally different outcome with this whole exact same kind of thing. And they had very low vaccination rates, and COVID is like not even a thing there. Let me play this.
Well, we're here in Africa, and you've been looking after us very much for that.
You're welcome.
I would like to do a bit of an update on the COVID situation in Africa. There was lots of uncertainties at the beginning. But let's start off with the situation now, today. Where are we? Getting near the middle of September.
Yeah. So when you look at the COVID-19 situation in Uganda, the situation is really calm. It's like we are returning to the norm where we were 2 to 3 years ago before the pandemic started. In Uganda, people are living normally and they are no longer worried about COVID-19 like it used to be. And when you look at the Ministry of Health, the measures were even relaxed a bit, and they are not updating daily like they used to.
When did they last update?
When you check on the website, you find that they last updated in 1st August. Yeah.
So 6 weeks ago nearly.
Yeah, 6 weeks ago.
Yeah.
And they have not yet updated, though their website and Twitter handle, they're active, but they're updating things that are of public concern at the moment. So it seems when you look at that information and you see in the public, when you move, I believe when we came on the way, you were able to see people in the markets, how people are moving. Generally, you barely get someone with a mask.
No.
It's like everything
completely
is very normal. Yeah, it's
crowded
normal.
Buses, crowded minibuses.
Yes.
Our restaurant last night was crowded. So
yes.
Back to normal.
Yeah, back to normal.
But you're a clinical officer, so are you seeing people getting sick with COVID, or is that finished?
No, I am not actually seeing people with COVID-19 again. Actually, at the regional referral hospital where I'm working, we set up tents for emergency cases for COVID-19 because we wanted to separate them from the general patients. But since the Delta wave ended and Omicron came in, now cases decreased, the tents are even dry. There's nothing there. We barely use them. I think in the past 3 months, I've not seen anyone that we've received on the emergency ward.
And this is a big city.
It's a big city. Yeah, even if you moved right now to the hospital, you barely get there anyone admitted with COVID-19. And yet it is a center in the region. In the whole region of Eastern Uganda.
So we can say in Eastern Uganda, to all intents and purposes,
yes,
COVID is finished.
Yeah, COVID is not.
Unless something dramatic is finished.
Yeah, unless something just happens. But if things continue the way they are looking like, we are good to go.
This is really good news.
Yeah.
And presumably this is due to very high vaccination rates in Uganda, is it?
Yeah, no, not really.
No? Oh, really?
Okay. Yeah, when you look at the vaccination, because we have the population of around 44 million. But the last data, when I check here, you see that they've given about 24,859,885 doses, but that includes first and second doses. So even if we took that amount, you see that only about 50% or close to 50%.
I've had one dose.
Yeah, have at least a dose.
A dose.
Yeah, so it has one of those who have had 2 and 1.
So that means 75% have had no doses.
Yeah. So we see that the majority of the population, they have not received full doses, but we are okay.
So if the reduction in cases is not due to vaccination with Rafa, why is it that COVID has essentially gone away now in Uganda?
Yeah, this could be possibly due to cross immunity from other viral infections, because here people are exposed to a lot of infections due to the healthcare system that we have. It's really struggling, and people barely reach the hospitals. So people, most cases, recover naturally. So that helps to build immunity, which can cross and fight uh, things like COVID-19 virus. And also, when you look at today's situation compared to the time when the Delta variant was there, we used to have a lot of cases, but now they reduced. And this came after Omicron came in. We saw that when Omicron had just come, the cases went a bit high. But in a few weeks, they started dropping. And from that time, they have really been stable. It was just until something like a month and some few weeks ago, when I think we had about BA1, BA2, when cases wanted to come up, but then the situation has gone back. So it could be that there is some sort of herd immunity, because when Omicron came, with the measures that we have, people were not even adhering well. That they opened up the whole country. People had mixed up. So people were infected, but then they were able to develop immunity, which is maybe helping in this case.
And when I look at things around here with the crowding in town and the crowding on the buses,
Yes.
if Omicron came, I think it would spread through the population here really,
Yeah.
really quickly.
Yes, yes.
Yeah.
Actually, when Omicron came, during that time when cases went up, almost every person everywhere had some flu-like symptoms. So it is most likely, only that the testing is low,
Very
but it's
low.
most likely that most of the people were infected, because at least everyone in the family, everywhere, they had those symptoms. But because of the population, also the population is very young. In most cases, people are able to go through those things.
So we've got this idea where when Omicron came, everyone in the country got a cold.
Yes.
And you saw this at
I
work.
saw it.
Yeah, yeah.
I observed it.
Yeah.
I was also at the hospital. I saw it, but because flu for us here, actually, flu is a common thing.
Yeah, just, well, a
When
cold
yeah,
rather
it's
than
a cold is
influenza.
something
Yeah,
that is not very serious, and you can easily go through it without any intervention. So when it came, people were talking, this is COVID, but that's how it went, and it stopped, but it helped. Yeah, after that, everyone felt okay, and from that time up to now, people are okay.
So we've got two possibilities. Omicron arrived in Uganda,
Yes.
and everyone got a rhinovirus cold.
Yes.
Or COVID arrived, Omicron arrived in Uganda, and everyone got an Omicron cold.
That could be the issue.
Yeah.
But the thing is that I really tried to follow the situation like closely, because I've really been observing this thing from the beginning. I was so interested, and I was seeing when Omicron came, I could compare the figures on Twitter, website of the Ministry of Health, and then I compare what I'm seeing in the community and in the hospital where I'm working, and you could see people having those flu-like symptoms. But they didn't last for a very long time. It was just there for some few weeks. When it went, we saw cases also started dropping dramatically. Yeah.
But we do know there was some Omicron because of the limited testing did indicate that Omicron was here. So we know it was here.
Yeah, it was here.
Yeah. Isn't the immune system amazing as well, that you can develop this immunity from exposure to one virus, but it's already sensitized to some extent from being exposed to other viruses?
Yes.
And we get this phenomena of, so we get the specific immunity.
Yes.
And we also get the cross immunity.
Yes.
But, well, the cross immunity is a form of specific immunity. It's not innate, I guess, but it's just, it all combines together. And I think the other thing in Africa may be the parasitic infections.
Yes.
Which are way more common.
Yeah, they are very common.
Is giving cross immunity to some viral infections as well.
Yes, that is very possible, because even on a medical camp that we are hoping to have on 16th, you'll be able to see some of those cases, and you see sick people. Some things may surprise you, but people live with a lot of diseases.
A lot of comorbidities.
Yeah, comorbidities.
Yeah.
that we are hoping to have on 16th,
We are,
you'll be able to see some of those cases, and you see sick people. Some things may surprise you, but people live with a lot of diseases.
A lot of comorbidities.
Yeah, comorbidities.
Yeah. And even the fact that people have so many comorbidities and untreated.
Yeah, so this is something that they're not covering, and because I'm sitting here searching for more information on this, and I'm really having a hard time. I'll probably come back to it another time because I don't have time right now to really just be searching. But it's like, Africa, different countries in Africa already have really intense systems, to deal with like outbreaks and so forth. They're really ahead of the curve in a lot of ways because they have to deal with some really nasty stuff like Ebola, smallpox or whatever. That stuff is really, really nasty. And so they jump on it really fast and they're really good about it. But the COVID thing was a thing, remember they were talking about the vaccines, and it was like we threw a lot of them away here in the States. They expired, and a lot of countries in Africa were asking for, but they wasn't getting them. So anyway, despite low vaccination rates across Africa, it seems COVID is just really dissipating, really kind of disappearing. Like, we're comparing it to China, who's still in zero lockdown, and they was on that from the jump, and it's been like 3 years now, and they're going through it. And Africa didn't even get the vaccines, and they seem like they're just living life normally, in a lot of places around Africa. So, that's interesting, and I think that's something that we need to think about. And then I also see how like they're not telling the truth related to these coverages of this information, but I'm sure the data is there. I know I can look it up. I know I can look up like the number of deaths and all of this, and I'm sure it'll show that across Africa was really, really low compared to other places, the West, and so they're not covering this that way though, because I was just searching right now, and all of the articles are saying Africa didn't deal with it very well, and people were dying and excess deaths and so forth and so on. So, but that's just them saying that's not like giving numbers. So I'm willing to bet that if they actually put the numbers there, it would not reflect what they're actually saying. And let me read some comments underneath this one. It says, the vaccine was not brought in for COVID. COVID was brought in for the vaccine. Once you realize that, everything else makes sense. Dr. Rena Fulmich. Another comment, it says, I had COVID in South Africa. I am unvaccinated. My symptoms were mild. Our human bodies have innate intelligence to heal themselves, aided by better eating habits, love of self, and no fear of what might happen, not listening to the gloom mongers. And, another thing, I want to be careful how I say this, but a lot of information is coming out about, people who were vaxxed and people who weren't, and the number of deaths doesn't reflect what they were saying. A lot of the people who died were vaccinated. I want to be careful how I say that. They're going to get me. Let me read some more. It says, many people in Africa had the luxury of locking down and had to work every day. Let me start over. Many people in Africa never had the luxury of locking down and had to work every day to survive. They weren't sucked into the fear virus that spread through Europe and America. I believe many have much stronger immunity and something else called common sense, which seems to be not so common in the industrialized West. There are enormous lessons to be learned from their approach. Another comment, says, natural immunity over vaccination for me, best decision I've ever made. Lots and lots of friends over the lost lots of friends over the mandates here in Canada. Could not even fly domestically for 8 months. I felt vindicated for what I felt all along. Another comment, it says, some people in the villages have never worn masks until now. Completely normal lives. Love to hear it. Another comment, it says, brilliant to hear this. It's so rare to hear Western professionals calling for the West to listen and learn from other regions of the world rather than enforce their own theories and narratives on them. A welcome humility and very important message. Thank you. I swear, I swear everything would be so much improved if we could just, we taught that all of these people are uncivilized, they're backwards, they're, undeveloped, third world, however you want to call it, that West East, you know. And so because of that, we don't listen to the stuff that they do. I think that, what works the best is what we should use everywhere across the world. We have the communications and we have the abilities to actually look at the data, put our freaking prejudices aside, and actually look at the data and see what works the best, and export that around the world. How come that's common sense? How come we can't do that? That is so crazy to me. It's so insane. Oh, we don't want to listen to how they did it because, they're backwards anyways. It worked. Yeah, that's beside the point. They're backwards. Let me read another one. It says, well done, Uganda. Excellent proof that a nation can handle a health issue without a singular intervention. Another comment. This was a disease of affluence. Fascinating. I'm in the U.S. and it is becoming obvious that our lifestyle had a lot to do with the high death rate. Another comment. It says, I traveled to Uganda for the first time after COVID and I was shocked how free everyone was. They are so strict in California. Another comment. Uganda is an inspiration for the rest of the world. Love seeing you reach out to other communities, Dr. John. Another comment, it says, great interview and of significant importance. Here is a theory to entertain. The Western world suffers from a processed foods addiction, which is detrimental to the equilibrium of our natural health system, a biochemical system that is easily thrown out of balance by wrong lifestyles and by the chemical content of those processed foods, which in a sense you cannot really call food at all. A strong immune system is attained by a proper lifestyle and real foods. These lovely poor people in Africa, as it turns out, that cannot afford Western chemical foods, had a strong natural defense against the virus. That is clearly our first line of protection. Eat natural and simple for God-given natural health. Another comment. Thank you, Dr. Campbell and Dr. Wiwafa for this amazing interview. My family live in Switzerland and none of them got the jab and there were very few deaths as well. What a wonderful interview. Thank you for all your research. You and a few other doctors kept me informed and gave me hope during the last 2 years. May God bless you. Another comment. This is more evidence of the horror that non-medical leaders have imposed on the peoples of the world. I really enjoyed this interview. Putting a face to Africa was heartwarming. Thank you, Dr. Campbell. Another comment. The good doctor just explained what any self-respecting health professional ought to know. Concepts of cross-immunity, herd immunity, and acquired immunity with immunological memory were condemned as heresy these past 2 years in favor of a single solution vax. This doctor has no ulterior motive. He's not being bought or coerced. He simply is here to do good for his patients. God bless him. A couple more comments. Fantastic discussion, docs. Yes, we can learn terms from the COVID experience in Africa. Funny how we in the West think that we're so smart and can almost predict everyone else's doom. Then we should have been concerned about our own problems. Another comment. So refreshing to hear someone who practices patient-centered medicine on a rational basis without corporate policies driving absurd processes. Another comment. Excellent report. I'm so pleased that Uganda proved to be a very different story. No vaccines accepted in my household either, and everyone is in top health. Another comment. Your journey has been an evolutionary and inspiration to countless numbers of those who have followed you over the past couple of years. Not only have you followed the data, which at times has led to uncomfortable truths and realization, but you've continued the journey in the spirit of helping people across the globe to navigate and make sense of the situation during times when such assurances were lacking. My sincere thanks to you, your contributors, your supporters, and all of those across the world who listen and are still listening, supporting, and stepping up. Thank you.
Yeah. Just woke up.
Mad interesting to me. I was about to go to sleep and this just woke me up.